Hi everyone, welcome back to our channel. Please like, share and subscribe our channel. Today we will discuss about the most important topic MCQ for the nursing exam, all nursing exam, lumbar puncture MCQs. First question, which spinal level is the most commonly used for the performing a lumbar puncture in the adults? Option A L1 L2, option B L2 L3, option 3 between L3 L4, option D T12 to L1. The answer is option C, between the L3 and L4. Next, which position is recommended for a patient undergoing the lumbar puncture? Option A, supine with the high with legs extended. Option B, sitting with the flexed neck and the back. Option C, lateral decubitus with the knee and chin flexed. Option D, prone with head turned. The answer is option C, lateral decubitus with the knees and the chin flexed, because this position widens the intervertebral space and making the needle insertion easier and safer. So we use the lateral decubitus with the knees and the chin flexed. Next, which of the following is the most important contraindication for the lumbar puncture? Option A, thrombocytopenia. Option B, severe headache. Option C, fever. Option D, history of migraine. The answer is option A, thrombocytopenia. Option A is the correct answer, because thrombocytopenia means low platelets. When the low platelets increases the risk of the spinal hematoma, and coagulopathy is an absolute contraindication. So thrombocytopenia is totally contraindication for the lumbar puncture. Next, which is the main purpose of measuring opening pressure during the lumbar puncture? Option A, assess the CSF glucose. Option B, evaluate CSF color. Option C, determine intracranial pressure. Option D, diagnose meningitis. The answer is option C, determine the intracranial pressure, because measuring opening pressure helps to detect the elevated or decrease the intracranial pressure, which can guide diagnosis and the management also. Next, which needle type is preferred for the lumbar puncture to reduce the post LP headache? Option A, Quincke cutting tip. Option B, Sporte a traumatic needle. Option C, Tohi needle. Option D, spinal epidural needle. The answer is option B, atraumatic or Sporte needle, because atraumatic needles reduce the dural trauma and lower the incidence of the post LP headache. So we use the atraumatic needle. So answer is option B. Next, which CSF finding is typical in bacterial meningitis? Option A, clear fluid, normal glucose and high protein. Option B, cloudy fluid, low glucose, high protein, neutrophilic pilocytosis. Option C, xanthochromia, normal glucose, lymphocytosis. Option D, bloody CSF, low protein, high glucose. The answer is cloudy fluid, low glucose, and the high protein and neutrophilic pilocytosis is the typically bacterial meningitis. We found in the bacterial meningitis. So answer will be option B. Next, which complication is the most common after the lumbar puncture? Option A, spinal hematoma. Option B, post-LP headache. Option C, infection at puncture site. Option D, nerve root injury. The answer is option B, post-LP headache. Post-LP headache is the occurs in 10 to 30% patient due to CSF leakage. It is usually positionally. Next, which measure helps prevent the post-LP headache? Option A, bed rest for the 24 hours. Option B, hydration and lying flat. Option C, using a cutting needle. Option D, administering an analgesic before the procedure. The answer is option B, hydration and the lying flat. Hydration and supine position for the more than 1 to 2 hours reduce the CSF leakage and headache incidence, and atraumatic needles are also helpful for this prevent the post-LP headache. So answer is option B. Next, which is the correct order of CSF collection tubes during the lumbar puncture? Option A, chemistry, microbiology, hematology, biochemistry. Option B, microbiology, hematology, biochemistry, chemistry. Option C, hematology, microbiology, biochemistry and chemistry. Option D, biochemistry, microbiology, hematology and chemistry. The answer is option C, hematology, microbiology, biochemistry and chemistry. The order minimizes the contamination and ensures accurate result for each test. So answer will be option C. Next, which of the following is a relative contraindication to LP? Option A, local infection at puncture site. Option B, increased the intracranial pressure. Option C, severe hypovolemia. Option D, all of this above. The answer is option D, all of the above, because all are the contraindicated for the LP. So answer will be option D. Next question, what is the appearance of CSF in viral meningitis? Option A, clear normal glucose, slightly elevated protein, lymphatic pilocystosis. Option B, cloudy, low glucose, neutrophilic pilocytosis. Option C, xanthochromic, high protein, low glucose, bloody, low protein, normal glucose. The answer is option A, clear normal glucose, slightly elevated protein and lymphatic pilocystosis is the appearance of CSF in the viral meningitis. So answer will be option A. Viral infection generally cause the lymphocyte predominance and normal glucose level. So answer will be option A. Next, in which condition is a xanthochromic of CSF seen? Option A, subarachnoid hemorrhage. Option B, viral meningitis. Option C, bacterial meningitis. Option D, multiple sclerosis. The answer is option A. Subarachnoid hemorrhage. Mainly subarachnoid hemorrhage seen in the xanthochromic of CSF. Xanthochromic color is yellow. Yellow in color is due to bilirubin from hemoglobin breakdown in hemorrhage. So this color is yellow. The answer will be option A. Next, which of the following is not a sign of correct needle placement during the LP? Option A, CSF flow. Option B, loss of resistance. Option C, tingling sensation in lower limbs. Option D, sharp puff felt. The answer is option C, tingling sensation in lower limbs. If tingling may be indicated nerve trauma or the correct placement is confirmed by the CSF flow. The answer will be option C. Next, which test is used to confirm CSF infection rapidly after the LP? Option A, gram stain. Option B, MRI. Option C, CT scan. Option D, EEG. The answer will be option A, gram staining, because gram stains allow rapidly identification of bacteria pathogens in the CSF. So the answer will be option A. Next question. Which position is preferred to measure CSF opening pressure accurately? Option A, sitting upright. Option B, lateral decubitus. Option C, prone position. Option D, Trendelenburg position. The answer will be option B, lateral decubitus. Option B is the correct answer, because lateral decubitus ensures the accurate measurement of CSF pressure. Next, what is the safe volume of CSF collected in adults for the diagnostic purposes? Option A, 1 to 2 ml. Option B, 5 to 10 ml. Option C, 15 to 20 ml. Option D, 25 to 30 ml. The answer is option B, 5 to 10 ml. Option B is the correct answer. The 5 to 10 ml is sufficient for the routine test without causing the complication. So the answer will be option B. Next, which nerve root is most likely injured if patient experiences shooting pain during the LP? Option A, L1. Option B, L2. Option C, L3. Option D, L4. The answer will be option D, L4, because injury to the L4 nerve root can cause the shooting pain along with the leg. Due to this, carefully techniques minimize the risk. If you taking care of the patient carefully, that can help to reduce and minimize the risk. Next, what precaution should be taken in a patient with the suspected raised ICP before the LP? Option A, immediate LP without imaging. Option B, perform head CT first. Option C, collect the maximum CSF. Option D, use cutting needle. Immediate LP without imaging, this is the wrong answer. Perform head CT first. Collect the maximum CSF. No need. 5 to 10 ml is enough for the any investigation. Use the cutting needle. No. The answer will be option B. Perform head CT first. That will be good for the patient, because LP in raised ICP can cause the brain herniation. That if we do the imaging, then ensure patient will be safety. Next, which CSF finding suggested tubercular meningitis? Option A, low glucose. Option B, option A, low glucose, high protein, lymphocytic pilocystosis. Option B, normal glucose, high protein, neutrophilic pilocystosis. Option C, low protein, high glucose, lymphocytes. Option D, bloody, low glucose, high neutrophils. The answer is option A, low glucose, high protein, lymphocytic pilocystosis in tubercular meningitis. The answer will be option A. In TB, meningitis typically show the low glucose, high protein and the lymphocytic predominance. So the answer will be option A. Next, which antibiotic can be administered intrathecally if indicated? Option A, gentamicin. Option B, vancomycin. Option C, penicillin. Option D, amphotericin B. The answer is option B, vancomycin. Because vancomycin can be used intrathecally for the resistant infection, doses must be carefully monitored. Next, which sign indicates traumatic LP? Option A, clear CSF. Option B, CSF with red blood cells. Option C, low protein. Option D, lymphocytic pilocystosis. The answer is option B, CSF with the red blood cell, because traumatic LP causes the blood contamination. Xanthochromic develops after the 12 hours of hemorrhage. So the answer will be option B, CSF with the red blood cell. Next, during LP resistance is felt while inserting needle, what should be the nurse do? Option A, forcefully push. Option B, withdraw slightly and redirect. Option C, remove the needle completely and try different side. Option D, increase the patient flexion. The answer is option B, withdraw slightly and redirect. Gentle redirection prevents the nerve injury and allow the correct placement. So answer will be option B. Next, which CSF analysis is essential in suspected multiple sclerosis? Option A, cell count. Option B, protein estimation. Option C, oligocolonal blends. Option D, gram stains. The answer is option C, oligocolonal blends. Because oligocolonal bands are a hallmark of multiple sclerosis in the CSF. So the answer will be option C. Next, how long should a patient remain the supine after the LP to reduce the headache risk? Option A, 30 minutes. Option B, 1 to 2 hours. Option C, 6 to 8 hours. Option D, 24 hours. The answer is option B, 1 to 2 hours. Because short supine periods reduces the risk of leakage CSF and also prevent the headache. So the answer will be option B. Next, which of the following is a serious but rare complication of LP? Option A, local soreness. Option B, spinal hematoma. Option C, mild headache. Option D, nausea. The answer is option B, spinal hematoma, because the hematoma can compress spinal cord or the nerve root, risk the increases in coagulopathy. Next, which CSF glucose level is suggestive of bacterial infection? Option A, less than 40 mg per del. Option B, 50 to 60 mg per del. Option C, 60 to 70 mg per del. Option D, 80 to 90 mg per del. The answer is option A, less than 40 mg per del, because bacterial consumption of glucose lowers the CSF glucose significantly. So the answer will be option A. Next, which is the preferred antiseptic before the LP? Option A, soap and water. Option B, povidone iodine. Option C, alcohol alone. Option C, chlorhexidine. The answer is option B, povidone iodine, because povidone iodine effectively reduces the skin flora and the infection risks. Next, which statement is true regarding LP in the infants? Option A, performed at L1, L2. Option B, needle should be 22 to 25 gauge. Option C, patient should be prone position. Option D, CSF pressure is not measured. The answer is option B, needle should be 22 to 25 gauge, because small gauge needles reduces the trauma. LP is performed at the L3, L4 and for the or L4 or L5 for the infants. So we use the 22 to 25 gauge needle. Next, which symptoms may indicate CSF leakage after the LP? Option A, fever. Option B, positional headache. Option C, vomiting unrelated to posture. Option D, rash. The answer is option B, positional headache, because CSF leakage lowers the intracranial pressure, causing headache when upright. So the answer will be option B. Next, which nursing action is important after the LP? Option A, encourage oral fluids. Option B, monitor for the neurological changes. Option C, observe the puncture sites for the infection. Option D, all of the above. The answer is option D, all of the above, because we have to care the patient for the hydrated, encourage oral fluids, monitor the neurological changes. If any changes will occur, we have to immediately inform to the physician. Observe the puncture site for the infection, or any infection is there or any fungal anything is there, we have to observe, and if anything wrong, we should immediately inform to the physician. Thank you everyone. Please like, share and subscribe our channel.